I think AR-V7 is recognized as one of the most common, if not the most common, splice variant. So I think this and other biomarker testing is going to be critical to really personalize the treatment approaches.
I mean, testing for AR-V7 in the first-line failure patients, I think is an important step for us. At that point, usually you don't know, hey, should we give another agent? Do we give chemotherapy? Now, granted, most urologists will not give chemotherapy, and so if that's the right answer, then they'll still get referred to a medical oncologist. But I think we'd like to be able to make that decision with the patient. So a tool that helps us do that is really important. So I think that at that point in time, this is a new thing. This is a new thing for urologists to say, hey, we tried first-line therapy, you're failing it, but I tell you what, we can do something to help guide us where we need to go. Now, the data for AR-V7 is strong. It really does show that those who don't respond won't respond, and those who get chemotherapy do better, and they survive better. I mean, there's a survival benefit by making that right decision. So these tools are necessary for someone like me who's a urologist to be able to guide the patient at this very, very complicated advanced stage. So I think it's good for urologists to adopt this because it'll give them clarity in terms of what they're doing, and you're not missing something.
I think AR-V7 is recognized as one of the most common, if not the most common, splice variant. So I think this and other biomarker testing is going to be critical to really personalize the treatment approaches, especially in the advanced cases where prior therapies have already demonstrated that the cancer is outsmarted and outgrown, the first or second line therapies.
I think the AR-V7 test is a very beneficial test in several ways. One, it provides us with a prognostic indicator or value to allow us to understand whether we have a patient. If they are AR-V7 positive, then we understand that this is a patient who has an aggressive prostate cancer type. You need to be aggressive about treatment to give them the best outcome. It also helps us understand whether I can give them a better quality of life with androgen receptor antagonist therapy versus IV chemotherapy. And depending on the results of that test, it'll allow me to give a patient more therapy with androgen receptor antagonist therapy, which is an oral agent. It's a better quality of life. It's not as frequent office visits, so the patients can continue to enjoy the things they enjoy doing at their time of life versus IV systemic chemotherapy. An AR-V7 positive test is essential in placing the patient on IV systemic chemotherapy, and that makes you recognize that this patient probably has a very aggressive disease process, and you shouldn't fool around with an androgen receptor antagonist therapy that may not be beneficial for that patient and should proceed immediately to IV systemic chemotherapy.
I think it's very useful, especially when you have a patient that either could get chemotherapy or could get another AR-targeted agent and trying to make that decision. And you really want to make sure that if you're going to put someone through chemotherapy with all the potential side effects, that's the right thing to do. Because if you have an option of using an AR-targeted agent in that particular patient, having a predictive biomarker that gives you that confidence to pick one over the other, I think is very helpful. And so we've used it several times now, and it does help in those patients that have already had one, and then you have a couple different options to say, you know what, you're probably going to get a better benefit out of going this route than the other route. So it's definitely, I think, useful clinically.